Don't forget to like, comment, and subscribe for your regular dose of Asian health information.
Regards to medication, anti-inflammatory painkillers, general recommendation is not to be taking painkillers for the long term, because any medication, if you take it for the long term, you're going to get side effects from it. For example, gastric pain. With regards to physical therapy, I think most physical therapists will work with a patient over a period of few weeks and few sessions to recover their problem. If a patient is not responding well to physical therapy, then I think it's a good idea to escalate the treatment to either injections or surgery. Now, with steroid injections, we try not to do the injections too often, because giving steroid injections too often to tissues can lead to its own set of problems, like thinning of the tissues and weakening of the tissues as well. If a patient doesn't respond to steroid injections, then I think most of us would consider a surgical option for these patients. I would say that all the shoulder patients that I see with shoulder problems, the majority respond very well to conservative or non-surgical methods. I would say that maybe 10 to 20% of shoulder patients may end up requiring surgical attention. It all depends on the underlying problem and what the investigations show. If the MRI investigations do show there's a torn tendon or a torn labrum, then those situations might require surgery at a much earlier stage. Those diagnoses do not respond well to physical treatment. So in our clinic, we give a variety of painkiller medication for patients with shoulder problems and even neck or other joint problems. These range from the very mild analgesia to the very strong analgesia. They also range from topical analgesia to oral analgesia. So if the pain is very minor and the patient is not keen to take any oral analgesia, then we ask the patients to put on a medicated plaster or apply some medicated creams to try and reduce their pain. If the patient is agreeable to take oral analgesia, usually we start them off by giving them something mild like a muscle relaxant or a Panadol-based muscle relaxant. If the patient's pain is a little bit more significant, then you may want to add on an anti-inflammatory painkiller, and these will help to reduce the inflammation within the joint. Again, it's recommended not to be taking these painkillers for the long term. So if I find that a patient is extremely dependent on painkillers for a period of few weeks, I think we really need to discuss with the patient whether it's a good time to escalate the treatment to something a little bit more effective. So in trying to prevent shoulder problems, I think the first thing I always tell patients is try and maintain a good posture. When they lift, when they carry, when they work out in the gym, when they sit at their desk, I think it's important to have a shoulder that's very retracted, so you get a good upright posture of your shoulder. Next, I also advise patients to maintain good flexibility and strength about their shoulder joint, and they can do these strengthening exercises. So for stretches, usually we put them in touch with a physical therapist for the therapist to teach them what kind of stretching they can do in the comfort of their homes. For strengthening exercises, basic strengthening can be done at home using minimal equipment, but if they need more focused strengthening or something that involves more specialized equipment, then a lot of these patients will have to go to a physical therapist to do it in the therapy clinic. So people working from home, I think one of the main things I'll advise them is to maintain a good workstation at home. I think now, because of comfort, most of us try to work off our couch or off our bed because we carry a laptop wherever we go. I think the advice I'll give them is try to maintain a proper workstation where you have a table at a good height, a proper chair, and a screen at eye level. As long as you have a proper workstation, chances are you're going to maintain good posture when you're working there. And it's important to keep an upright posture, and also for your shoulder, it's important to keep it retracted so that the muscles are more balanced. Other than that, I'll tell them that if you're working for a period of about 30 minutes to 35 minutes, it's good to get up and walk around and stretch your joints for 5 to 10 minutes, have a drink before you come back to your workstation. Sitting at the workstation and working continuously for more than an hour is going to give a lot of strain and tension in the tissues, and you're going to feel more painful.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.